I'll be talking first at all about the idea of the autism spectrum and the fact that the IQ of people on the spectrum really varies quite widely. There'll be several slides about that, and then we go on to talk about reviewing an updated understanding of ADHD and its treatment. And then once we've got that, then I want to talk a little bit about the overlap between ADHD and the autism spectrum, because I think there's been a lot of misunderstanding about that. Then we'll talk a little bit about other disorders that often overlap with ADD. And I've got the abbreviation. Sometimes you'll see my slides. I refer to ASD, autism spectrum disorder. But I also, as you can see on the fifth item of the agenda, I also use the term Asperger's syndrome. I published a book about that a couple of years ago. And that's the category that was in the DSM for a while as a way of describing those who had average or above average intelligence who were on the autism spectrum. And then the people who write the DSM decided they were going to take that Asperger's syndrome out as a diagnosis and just say, okay, well, it all is going in with the autism spectrum. I frankly think that was a mistake, but we'll be talking a little bit about that as we go on. So this is the menu. I'm hoping you'll find it of some interest. Now, we don't get surveys done by the CDC every year, but the most recent one that we have about the prevalence of autism spectrum disorder in the United States was in 2018. And there's no reason to assume that that's changed dramatically, but I would like to encourage you to look at the numbers here. The question is, what's the IQ range of the people who are seen as on the autism spectrum? And the best data we've got on that, you see in the middle of the slide, a little over a third have IQs below 70, which means that they're much more limited in terms of being able to do most of the academic skills that, and other skills actually, that most other kids that age are. And then about a quarter of them have IQ, I'm talking now about kids on the autism spectrum, about a quarter of those kids have IQs that range between 71 and 85. Now, the mean of IQ is 100, and 90 to 109 is average, and then 110 to 119 is high average, and then 120 up above that is in the superior range. But look at the where the red arrow shows here at the bottom. 44% of those people on the who turned up as having autism spectrum in the survey that the CDC did that we're talking about here, that was the biggest group, and those were people who had from IQs of 86 to up 130 or plus. And so what we're talking about here is that on the one hand, about 85% of those who are diagnosed as autism spectrum are recognized by the time they're about 3 years old. But many of the 44% with the higher IQ often do not even get recognized as having autism spectrum problems until much later. And that's because they are not as obviously handicapped in terms of basic reading, writing, and math skills. They're not as impaired in their social functioning, even though they have a lot of difficulties with it. And they, I think, are a very vulnerable population. So what we're talking about here today is when smart kids, meaning kids who have average or above average IQ, are on the autism spectrum, what happens when they also have ADD? So the big point here is, and there's several studies that have been done on this, that the number of kids who suffer from Asperger's syndrome or who are in that range, which is average or above average smarts, is double the number of those who are suffering from classical autism. However, the main thrust of most of the academic literature about this, the journal articles and books, has focused much more and necessarily on the more severe forms of autism spectrum disorder. But the problem is that not so much attention has been paid to kids and young adults who possess the milder forms of the disorder, which are not always recognized until like maybe middle school or high school, and sometimes not even recognized until kids have grown into young adults. And often they're not seen for getting any help with this until well into their adulthood. That's an area that's been neglected. And so we've got this delayed recognition for those with a higher IQ. And I'm not just talking about those with very high IQs, but those who have average or above average are often not recognized and diagnosed. And I'm talking now, note the red words, with autism spectrum. Autism spectrum often is not recognized until adolescence or adulthood in those who have IQ in the average or above average range. And yet their expectations from themselves and others are much greater than would be the case for other people on the spectrum. So then the question is, okay, well, if we're going to talk about ADHD and we're going to be talking about people who are on the autism spectrum, how many are there? Well, in the community studies, this is what we get in a lot of the research studies, that you have to give a range because different studies are picking up and defining different ways who it is they're studying. But in community samples, meaning just people out there in the communities, of those who are diagnosed with autism spectrum, the studies range between about 13% and 50%. That's a wide range, but the fact is that's where we are in terms of the research data. However, in clinical samples, if you're looking at people who actually come to clinics and are diagnosed with autism spectrum, you get numbers that look considerably different. And they range anywhere from 20% at the low end to 85% at the high end, depending on which study you're looking at. From a clinical point of view, there are a lot more people who have ADHD on the autism spectrum than many people realize. But I'd like to switch over now and talk a little bit about ADHD and how we understand it. ADHD has been recognized for a long time, but not always with those particular labels on it. The first time that ADHD, what we now call ADHD, was recognized in the English medical literature was back in 1902. But from 1902 until 1980, it was all about little boys who were hyper, had a lot of behavior problems. It was just basically a way of describing hyperactive and behavior kids, little kids who couldn't sit still, wouldn't shut up, and are driving everybody nuts. And there were a number of different efforts to describe this better and to then be able to recognize it. But the fact is, from 1902 until around 1960, mostly this was thought of, this was the syndrome of ADHD, was thought of as simply misbehaving kids. And it was not recognized. It was a behavior problem. Now, what we've gotten into increasingly over more recent years, over the last couple of decades, is to recognize that you can write an equation that says ADHD equals developmental impairments of the brain's self-management system. We call that its executive functions. Now, what do we mean by developmental impairment? This means that the development of the things that go into the functions that go into the brain's self-management system, its executive functions, is slowed often in comparison to other people who don't have ADHD. And but it's not, if you're in a motor vehicle accident, for example, and a person hits their forehead hard on the dash, you may find that they develop symptoms that we would say those are like symptoms of ADHD. Likewise, if a person has a stroke, depending on where the stroke is, you may see impairments that look like ADHD, when in both of those two examples, they'd never had the symptoms before. What we call ADHD is when it's developmentally impaired. When they used to say it had to be sometime before 7, and then they changed it now to 12. But what I was saying is they basically already had it, and it's not something that resulted just from a head injury or some other medical problem. It's highly heritable, as we'll talk about in a few minutes. Now, when can you notice if somebody's got ADHD? Well, there's some of them where it's obvious very early, and the symptoms that cause ADHD to be recognized early are usually hyperactive behavior. Just kids that are very difficult to manage, and so you do see that. It used to be they said it had to be evident, at least some symptoms of it, before the kid was 6 years old, and then gradually that moved up to 12. But in many cases, it doesn't even show up. I'm still talking about ADHD now. It doesn't even show up until middle elementary or junior high. And there's some people where you don't see the ADHD impairments until the kid moves out of the house and doesn't have the parents around to help them get organized and do what needs to be done. So this is the way I would define what we're talking about here, is that ADHD, incidentally, you'll sometimes hear me say ADD, and other times ADHD, but I'm not trying to designate subtypes. I use the two terms interchangeably. But it's essentially a developmental impairment of the brain's management system. It's often referred to as its executive functions. And it's really talking about the neural networks inside the brain that deploy and manage critical skills for doing a lot of the stuff we do day by day. So what are executive functions? It's not just one thing. It's a wide range of central control processes of the brain that connect and then prioritize and integrate cognitive functions for us moment by moment. The metaphor that I often use to think about this is, if you picture the conductor of a symphony orchestra, who doesn't have any instruments that he or she plays, but they are the ones who select what's going to be played. They're the ones who keep the musicians on time, who bring in the strings and then fade out the strings and pull in the timpani, or bring in the brass and organize it and stop it and start it. Without a good conductor, you don't get very good music out of a symphony orchestra. And what I'm proposing is that we could think about the functions that we're talking about, its executive functions that are the primary characteristics of ADHD, as being like the conductors of the brain's symphony. These are the operations of the brain that operate the management parts of the brain. Muriel Lizak, a prominent neuropsychologist, wrote about, she was trying to describe executive functions. She said, executive functions are really the things that have to do with, will you do it? And if so, if you are going to do it, how are you going to do it? And when are you going to get around to it? Which really covers quite a bit of territory. If you look at the three diamonds here, will you do it picks up on issues of motivation and activation, getting organized and getting started. How will you do it? Planning, and then prioritizing, and then when the hell are you going to get around to it? The timing of when you're going to do it, and critically remembering. But we'll talk more about the specifics of what's involved in ADHD in just a minute. Before we do that, I want to emphasize that these executive functions that I'm thinking, remember, I'm talking now about an equation that says ADHD equals developmentally impaired executive functions. Most tasks that require executive functions are not working on just one piece of the executive functions I'm about to describe. It involves multiple functions that work together, functions of the brain. And executive functions usually operate not with so much conscious deliberation, but with automaticity. Now, what I mean by that is the same thing that we do, for example, when when a basketball player is driving into dribbling the ball and driving in to shoot a basket, he or she is not saying, now I move my left foot forward, now I move my right foot forward, now I drop my shoulder a little bit. These things are going on so rapidly without conscious, now I had to do this, now I do that, that the well-practiced player is doing. And when you're an experienced driver, you're not thinking about every single move you're making. You have to be focusing on a variety of different things. But the question then is, okay, well, how do you tell when somebody has ADHD or does not? And there's some people who still talk about this as, oh, you need a battery of neuropsychological tests, at least a couple of hours of having a psychologist and a neuropsychologist test them using a variety of tests that are used in an office. I'm not the only one who says this, but I certainly am one who says those are not tests that are helpful for diagnosing ADHD, the neuropsych tests. They are very helpful for identifying how much of the brain is damaged in a stroke or in a traumatic head injury. But if you want to understand where the problems are for people with ADD, you need to do a clinical assessment, which means meeting with people and talking about them, of what they have trouble with and what they can do in functioning in daily life. It's not the neuropsych tests that are useful for that. Now, I'm about to show you a diagram that some of you may already have seen that I've developed over the years in describing the various aspects of ADHD. But before we get to that slide, I'd like to just ask you to think about these two characteristics of ADHD symptoms. One is that this is dimensional. This is not an all or nothing deal. It's not like being pregnant, whether you are pregnant or you're not pregnant, and there's nothing in between. It's more dimensional, which is to say that everybody has some of these impairments I'm going to be talking about as characteristics of ADD. Sometimes. All of us do. The difference is that they're more chronic and they're messing things up for them a lot more. But the other thing that's puzzling to a lot of people about ADHD is the second bullet here, the situational variability of it. I've evaluated well over 2,000 children, teenagers, and adults who have ADHD. And I have found that every single one of them that I've ever seen has a few things they can do, a few activities they can do, or some skills they have where they have no difficulty doing the very things that they have so much trouble with in almost everything else. And as a result, often these people will be seen by teachers and sometimes by parents and sometimes by doctors as, well, it's just a willpower problem, because you can do it here and you can't do it there. I'm going to talk more about this in just a couple of minutes, but this is a critical part of being able to understand ADHD, that it looks like it's a willpower problem, but it's not. More on that in just a couple of minutes. This is the model that I work with, and I've published a number of 7 books in talking about it. And I'm just going to talk briefly about this, and then we'll go on and talk about it. If you're interested to get more information, there is a video I have on YouTube, which is just 28 minutes long, and you can just tune in on YouTube, and it's called What is Attention Deficit Disorder? And it's got my name on it. And in the 28 minutes, you can get a fairly detailed picture of what the characteristics of ADHD are, at least according to my work. But let me talk about this. Down here at the bottom, where it says activation, focus, effort, emotion, memory, and action, those, you can think of those as just labels, as though these are baskets of related cognitive functions. Now, the reality is that most of the things we do that require executive functions require interaction from a number of these different things at one time. Getting organized and prioritizing and getting started. focusing and being able to keep up the focus and then shift focus when you need to. Regulating alertness, which means being able to get to sleep when you need to sleep and being able to stay asleep when you need to stay asleep, and then being able to wake up when you need to wake up. Sustaining effort. And then being able to process things in a reasonable amount of time. Emotions are not listed at all in the DSM criteria for ADHD, but managing frustration and modulating various emotions, that's something you hear about from a lot of people who have ADHD themselves or who have kids who have ADD or teach them. Memory is important, but if you ask people who have ADD, how's your memory? Often they'll say, oh, I've got the best memory in my family. I can remember stuff nobody else can remember. They'll give you some example about some movie they saw 15 years ago, and they can tell you every single detail of the aspects of that movie without any difficulty at all. Their long-term memory is good. Some people, they're really good at remembering songs or remembering various activities that they've included. But in this case of ADHD, and this is the way it is, it usually shows up with working memory. It's low, the difficulty not of remembering things from a long time ago, but remembering what the hell is happening right now and you just did. For example, when you go in the other room to get something and you're standing there scratching your head or what the hell you came in here for, that's an example of working memory not working very well. And then monitoring and self-regulating actions. This isn't just about whether your knee is bouncing constantly or you're talking too damn much. It's being able to slow down when you need to slow down and speed up when you need to speed up. So these are the labels on these, what you might think of as baskets of related cognitive functions. And it's not like everybody with ADD is all the same, but usually you're going to see some impairments in these various functions that are alluded to here. This is a very common problem where there's a 16-year-old kid I saw who very bright, IQ's up in the 99th percentile. He was an honor student until 7th grade. And then gradually his grades started going down and he didn't seem to have much motivation for doing things. 9th and 10th grade, the grades started dropping. And at that time he was brought in to see me, he was failing almost all of his subjects, except for the fact he was really good at math and was getting an A in that. Teachers didn't see any behavior problems. Sometimes he'd participate pretty well, but there were a lot of missing assignments and poor preparation, didn't do the assigned reading or homework, seemed disorganized. Parents are saying, we're sure he's not doing any drugs or alcohol. He doesn't seem to have depression. He does have some friends. He's very involved in music and a lot with computers, lost his eligibility to play sports. And the kid says, you know I should do and want to do the work, but I just can't get myself to do it. My friends say I have ADHD. I'm putting this in here to say that regardless of how smart somebody is, if they've got ADHD, they often have difficulty doing things that they know they should do and that they want to do, but they just can't get it together to make it happen. Now, this gets back to the central mystery of ADHD that I was talking about before, and that's the situational variability of symptoms. It's like, why is it that you can focus for this thing but not for that thing? You know, I had a kid like that, one that I just read about, a goalie who was an amazing goalie for his high school hockey team. And he could pay attention when he's playing hockey, and he knew where the puck was every second of a fast game. But he had a lot of difficulty focusing on anything else. Now, it's not always sports. Sometimes it's video games. Sometimes it's being creative with little kids making Lego block constructions and older kids taking car engines apart and putting them together. I'm talking about kids, but I'm also talking about adults. Or why can you focus now, then, but not now? It's like, so what I'm proposing is that often if a person has ADHD, they can, if they're attracted to a task, if it really interests them, or if they feel they have a gun to their head and that something they do not want to see happen is going to happen soon, if they don't take care of it right away, under either one of those conditions, many people with ADHD are able to focus quite well. But their motivation and ability to sustain that doesn't work out so well if it's not something that either scares them or really attracts them. So what this leads to, of course, is what I refer to as the central mystery of ADHD. And the two hypotheses are, it's just a matter of willpower. That's what a lot of people believe, including a lot of doctors who just don't have that much training about this. But I had a college kid one time who said, I've got this sexual example for what it's like to have ADD. He says, the guy thing, but I think even women can understand it. He said, having ADD is like having erectile dysfunction of the mind. If the task you're trying to do is something that turns you on, if it really interests you, you're up for it and you can perform. But if the task you're trying to do is not something that's intrinsically interesting, if it doesn't turn you on, you can't get it up. And if you can't get it up, you're not going to be able to perform. And in that situation, it doesn't matter how much you may say to yourself, I need to, I ought to, I should. You can't make it happen. It's simply not a willpower kind of thing. And if there's nothing else that I'm able to leave you with today in this talk, I would hope that you could appreciate that the problems with ADHD that look like it's willpower, where you can do these things but not those things, is more like erectile dysfunction of the mind. It's not a matter of somebody being lazy or just not giving a damn. Now, let's take a couple of minutes to talk about the physiology of this. ADHD is a highly inherited program in the development of these executive functions. It's not something that is all developed by somebody when they're 3 or 5 or 10 or 15 or even 20. These executive function infrastructures tends to develop a little bit later, on average about 3 years later, in people with ADD, but they don't get fully developed for most people until they're about 18 or 20. And it impacts the development of networks in the brain and communication between the networks and in other parts of the body. And it involves electrochemical communication between neurons. And the heritability of it is important because out of every 4 people diagnosed with ADD, one of them has a mom or dad who's got it, whether they know it or not. And then the other 3 people of the 4 who have ADD, if they don't have a parent who's got it, usually they've got a grandparent, an uncle, an aunt, a cousin, a brother, a sister. It's highly genetic. Now, I've got just a few slides here that I'm using to talk about the complexity of the connections. We've got about 100 billion, every one of us has about 100 billion neurons in our brain. And they're sort of jumbled together like this, and they're pretty complex. But the thing that's interesting is they communicate with electricals, low voltage electrical signals. And so when you take one out and separate it from this intertwined mass, I'm looking now at one single neuron. These are the parts of the neuron that pull information together and pick it up. But then this is the synapse. This is the one point of connection of one neuron with another. And so we've got about 100 billion of these neurons, every one, and they're about the size of it, they're about 2/3 the diameter of a human hair. Every one of them interacts with over 1,000 others in complex subsystems. They've got to be able to talk to each other with these low voltage electrical impulses that have to jump across that gap in the synapse, which I'll show you again in a minute. And it happens so fast that you get 12 across in just 1,000th of a second. Now, in order to have that happen, there are chemicals that are made in the brain, about 50 of them. Every neuron uses one of these, and they're stored in little vesicles near the tip, which you'll see in the next neuron, in the next picture. And when the electrical impulse comes, many dots of that chemical are released, and that's what allows the firing across the gap. Here's the synapse. This is the sending cell. This is the receiving cell. And remember, they're all jammed in together. And then in these little vesicles, these little bubbles-like things, that's where the chemicals stored. And over the other side, what you've got are the receptors that are there to receive it and pick up the charge. So this message comes zipping in, and as it does, it's causing the release of little bits of the dopamine. There are a couple of other neurotransmitter chemicals involved. And then if there's a good release, it'll hit these receptors, and then that will send the charge on further. And this happens in fractions of a second. But then after that, we got to get it cleaned out. You can't have all that dopamine sitting in here. And so you have these things called transporters, which are little tiny cells that are not shown directly except by representation here. And they suck it back in. So it's like a little vacuum cleaners. They go suck it back, and then that's ready for the next thing. You get 12 transmissions and reload in a millisecond. So the bottom of the message here is ADHD is fundamentally a chemical problem, and the most effective treatment of it is to change the chemistry with medication. And unless you get that changed, other interventions are not likely to work out very well. Just a couple of things more I want to say about medications. The medicines that we use that are officially approved by the CDC for treatment of ADD have been demonstrated safe and effective. But they don't follow, dosing doesn't follow just how many milligrams of medicine do you give according to how old a person is, or how much do they weigh, or how severe the symptoms. It needs adjustment to fine tune it according to how sensitive that person's body is to that medicine and to the time frames of what they're doing. I see little kids, I see teenagers, I see adults. Most of the little kids are taking small doses, but there are a few of them, not many, where you've got to go almost into the adult dosing range. I'm talking now first and second graders. Even for them, we've got a few that we have to go up pretty close to adolescent or adult doses. Most of them, that would be way too much for most of them. And on the other end of it, among the adults I see, most of them are taking fairly hefty doses, but there are some of them who are just as big as others, maybe over 6 feet and carrying about 250, 280 pounds, are taking doses not much more than you give first or second graders. And so you've got to pay attention to the sensitivity of the person's body and to the time frames. Now, this is go back for a minute. This is just a close-up picture of the one neuron, the sending side, meeting up with the other receiving side. And what they're trying to show you here is the message is coming through, and you get the release of the dopamine, which may be an amphetamine, not methamphetamine, by the way, but amphetamine or methylphenidate. And the little star things are just showing that that's released. And then that allows that charge to cross over and hit the receptors on the other side. And then we've got these transporter things, which these are the objects which sort of suck it back in. That's the matrix in which these things go. Now, I want to say one more thing that's often missed about ADHD, and that is if you're taking stimulant medicines, people often wonder, what are the side effects? If a person's getting too much of it, during the time that the medicine's supposed to be working, this is the kick-in time, which could be anywhere from half an hour to an hour or so for stimulants. And then there's a time when it works, with short acting could be about 3-4 hours, and longer acting anywhere from 6 to 9 or 10. And then it comes down. If during the time that medicine's supposed to be working, the person's feeling wired, like they've had way too many cups of coffee, or crabby, where everything is pissing them off, or so serious where they sort of lose their sparkle, they don't feel much like interacting. If that's happening during the time the dose is supposed to be active, the dose is probably too high or not the right medicine for the person. However, if they're not having any of that stuff here in the time when it's supposed to be working, but they do have any one of these three effects in the time when you expect it to be wearing off, it's a completely different problem. And it usually can be fixed easily by giving a smaller dose of the short-acting version of the same medicine, so you can get this to drop off, so they don't come off as though they're crashing and driving off a cliff, but it's more like an exit ramp from the freeway. Okay, now I want to mention just in general the fact that people who have ADD are very likely to have something else with it. Sometimes it's something like a reading disorder or math disorder, anxiety disorders, depression, mood disorders, oppositional defiant disorders, obsessive compulsive disorders, substance use disorders, and then for the remainder of this talk, I'm going to be talking a little more about autism spectrum disorders. But the point is that very rarely do you find somebody who has just ADD. You know, for example, the rate of having an anxiety disorder, if you're a kid with ADHD, without ADHD, but if you have an anxiety disorder, about 5% have it. But if you're looking at kids who have ADHD, the anxiety disorder rate is closer to 35%. You get very similar numbers for the various aspects of comorbidity. Now, off to talk a little bit about autism spectrum, and I'm talking now about the range which would be referred to by the old system as Asperger's syndrome. That's just named for an Austrian physician who was the first one to write about it. And I put up these two pictures because these are sort of stereotypes of what TV talks about as somebody who's autistic, and smart. And Jim Parsons, with the Shelton, the Big Bang thing, and then Leonard Nimoy with the pictures from Star Wars. Now, think about the fact that there are a number of different kinds of smarts. Howard Gardner wrote about this very well years ago. There's some people who are really good in language. They're good at oral and or written communication. Some people have musical smarts for creating and performing music. Some people have very logical math intelligence for calculating and reasoning. Some have scientific or technical intelligence. Some have visual spatial to design and create shapes. Some have body skills for actions and movement like a gymnast. And then there's the other two that are more involved in what we're talking about with autism spectrum, the smarter people in that group. Personal intelligence, understanding one's own feelings, and also interpersonal intelligence, being able to read and understand, tell where other people are coming from. It's these two that are in yellow that are the parts that are most important when we're looking at. Now, this is just a list of some well-known people who've been identified themselves as having Asperger's syndrome. Elon Musk has been having some troubles recently, but these are actors and other performers who, I'm just giving this as an example of some people who have some of these difficulties and have claimed it, that we would consider as part of Asperger's syndrome. Simon Baron-Cohen over in the UK did some research with people he identified as having Asperger's, and he wanted to find out what were they like as when they were kids. And he said, well, they tend to be loners. They often don't know how to interact with other kids their own age. They often prefer to talk with adults. They don't get invited to play at classmates' homes or to birthday parties as much as most other kids. There's not a lot of social pretend play. They're likely to be more focused on building things or reading factual books. They often have a really strong interest in a few things, often learning certain kinds of facts, and can be very knowledgeable in this. They're specific things they're specifically interested in, but often they were reported, and then we got into history from these people, to have a lot of difficulty getting their homework done, and often were failing, even in spite of the fact they were smart, were failing in some academic subjects. If you're looking at people with this higher functioning end of the autism spectrum, the ones we talk about as having Asperger's, there's a lot of differences. They're not all alike. This is just an example of the different kinds of personality profiles. Some of them are kind of scaredy cats. Some of them are overly dependent and clingy. And some of them are more arrogant, know-it-alls. Some are very isolated loners. Some of them are little adults who are trying to take care of other kids and everybody around them. Some of them are always on the sidelines just watching. Others are intrusive and butting into things. Some are spoiled brats some of the time and very demanding, very driven, high achievers. And others are fragile. Some are overreactive. Some would like to be close to other people, but only at a distance. Some are perfectionists and rule enforcers on their peers. So this is just a reminder that we're not talking about people who are all alike. I want to give you a few examples. This is Joshua, and he was 11 years old, and this is a direct quote of what he was saying to me. He said, I'm in school to work ahead and to get to college faster where I can be around other people who are very smart like I am and who share my interest in music and theoretical physics. Imagine what it's like to have an 11-year-old talking this way around his friends. I don't have friends at this school. I'm lonely there. The other kids aren't like me, but at least I'm not getting bullied the way I was at my last school. I used to be pretty depressed and had thoughts of suicide, but that's been better recently, but I still worry. This is just one profile and an aspect of a profile for one kid who's 11 who was on the autism spectrum and was pretty smart. Incidentally, this was several years ago, and I've seen him a number of times since then. He's actually doing pretty well. There's a 12-year-old. Parents are saying, our son with ADHD is doing okay in his schoolwork, but he gets teased a lot. And he makes a lot of trouble for himself by being too critical of other kids. Despite what we try to tell him, he can't keep his opinions to himself. He's always quick to point out when another kid makes a mistake, not only during classes, but also in his practices and games with his baseball and basketball teams. He starts middle school in 2 months, and we're really concerned about how he's going to get along socially because of these attitudes. There's a girl. She said, I read about Asperger's. I think I've got it. I don't like any of the kids in my class. I think they're pretentious and rude. They think I'm always in another world, and I am. I like to isolate myself and just read or write stories or songs and play games or make a car. I used to get good grades, but this year I'm not getting much done. And next year, there's high school. This is picking up on something that, sorry, this thing is jumping on me. Bella's story is illustrating a reminder first that this is something that Asperger's and autism characteristics are you do see girls with that. They're not as easily recognized, but they do show up, and they're there and are often overlooked. She was somebody who just sort of kept away from other kids, and yet she was in very small classes at the time. She was 13. But she's looking forward to what's it going to be like when she gets to be high school. Here's an example of how parents sometimes get into conflict with one another about how to deal with their kids who are fairly smart, and particularly if they've also got autism as well as ADHD. And they said, our son's now in 10th grade. He's got ADHD. He's missing too many days of school. Complains of having a headache, and then his father lets him stay home when he's not really sick, and he has no friends. He's avoiding school just to get away from the work and the kids who tease him. He just reads or plays video games all day. My husband's unemployed, the woman said, so he stays home while I have to leave early to get to my job, which is our only income. What can I do? You can imagine the arguments that these people were having, because each parent had a different approach. And, I call this the battle between the person who's like the marshmallow and the person who wants to put the pressure on and really get organized. Both of them are right, but what parents often end up arguing with each other about strategies. There's a little different story. This is 2 years earlier. There's the woman, her grandson she's talking about, was struggling in middle school. Anytime a teacher pointed out even a minor error in his work or suggested adding more elaboration in a paper, he'd just start crying and walk out of the class, not willing to discuss it with anybody. Imagine how well that goes over when you're in middle school. He was never a troublemaker, but he was painfully shy and withdrawn from other kids. He clearly was on the autism spectrum. With support from his teachers and medications, he's now completed his first year of high school with all A's and B's. He's actually made several friends, which is actually more important to her and to him. So in looking at the overlap between ADHD and high-functioning autism spectrum disorder, or Asperger's, whichever you choose to call it, this is a study that was done at Harvard Medical School. And they had a study that was really interesting on this question. They had 140 kids between the ages of 6 to 17 who had been referred to their specialty clinic for autism spectrum disorder, who had IQs 85, which is getting into the high average, or to the point where you're into the beginning of the average range, and they had an autism spectrum diagnosis. That's what they were brought in for. When they checked them out, 76% of those who were diagnosed carefully at this Harvard hospital unit also met the diagnostic criteria for ADHD. But here in the yellow is the most important part of that for take home. 41% of those who had both autism spectrum and ADHD had not received any treatment or assessment for their ADHD. It was like the doctors had picked up the autism spectrum, but they stopped looking there. And as a result, they ended up then without noticing the fact that they had two problems, the autism spectrum and the ADHD. Now, we do have treatments that work for ADHD. If you go online and you'll check it out, what treatments for ADD, you'll find all kinds of things, most of which there's no science behind them. For the medications, we do know that the SBC is just an abbreviation we use in our clinic for sensitive body chemistry. Particularly with those kids who are on the spectrum, start with small doses. For ADHD, we often use stimulants or a combination of stimulants and guanfacine. Atomoxetine works for a few people, but not for most. And then to the ones who are really excessively anxious or have obsessive compulsive disorder or mood problems, there we might want to utilize some fluoxetine, Prozac, or sertraline, Zoloft. And for excessive hyperactivity or impulsivity or aggression, we often use guanfacine. And then if there's a problem with things getting a little too flaky and confused, Abilify. Now, this is just mentioning a few things. I published a number of things on each of these. The treatment for ADHD or somebody who has Asperger's syndrome, the first thing is you got to educate about ADHD and Asperger's syndrome as is needed for the patient, for the family members, and for the teachers. That's the first thing, and you don't just start with medicine. You need to provide adequate support and scaffolding, especially for these kids when they're dealing with new situations. The move from elementary school to middle school, and from middle school to high school, and from high school to college, those are tough for people who are dealing with these two problems. And you need to be very careful about working out adequate scaffolding to support them doing that, making those transitions. It's important also for parents and teachers working and clinicians working with those who have Asperger's syndrome and ADHD to utilize teachable moments that you might have to help them understand social interactions, because the nature of this autism spectrum disorder, particularly in the higher functioning, is they're smart people, but they are not particularly smart about reading other people's emotions and about how other people feel, and often they're not that good about being able to recognize how they feel. But then the bottom line here, fine-tune, carefully selected and fine-tuned medicine to alleviate ADD. It's the same medicines we use for people who don't have autism spectrum, who have ADD. And then if you need some other medicines that have to be brought in for other problems, that may be done too. This is a sentence that comes out of the report of that study that I just described to you that Harvard did. And what they said after studying the fact that so many of these kids who had been brought in to get help for autism, their autism spectrum disorder, who were intellectually capable, pretty smart kids, at least average and many times better, if they've got the ADHD, that's going to seriously undermine their learning and their social functioning, worsening an already compromised social performance, and can and often will predispose these kids to increased risk for disruptive behaviors, for mood dysregulation, and substance use disorder, and a variety of other problems that make it very difficult for them to function. This is the name of the video I mentioned earlier. It's had 8.5 million views. It's a 28-minute video. It's free. You can get it on YouTube anytime. And this is a list of the books I've published on this. This book was published just a year and a half ago about ADHD and Asperger's syndrome in smart kids and adults. And it's got a lot of case examples in it. If you want something that will explain in plain English a lot of the medical and psychological stuff that goes on with ADHD, not just related to autism spectrum, this book, Outside the Box, will be helpful. Smart But Stuck is about emotions in teens and adults with ADHD. This is a brief summary of the executive function thing. This is a big reference work. This is not anything most people want to buy for their house, but for professionals, it talks about, and I didn't write the whole book, I edited it and wrote some of the chapters talking about ADHD and complications that you see a lot. And then this is the first book I published. It was done by in about 2000, early in 2000s, by Yale University Press, and it's just a pretty thorough description of what we know about ADHD.
If a parent suspects that there's just something more going on with their child with ADHD, and perhaps they may have some, autism spectrum disorder, you mentioned earlier that it's often overlooked. And in order to avoid that, what can a parent do if they suspect that there may be something else going on?
It's a difficult task sometimes because it's not easy to find people who know a lot about ADHD at the same time a lot about autism spectrum disorder. So if you've got a child who you've been diagnosed as having an autism spectrum disorder, then you want to do some reading and get information, for example, but in Chad's materials, or in some of the books that I've published or that others have. Russ Barkley has done a lot of good work on this stuff. Get some information and then inquire through chat groups. Often you can get some leads about where to find some professionals who are specialists in this. And if you're talking with somebody who just doesn't quite seem to get it or is not willing to listen to your situation, get somebody else. But Chad can be a very good resource on this. And for those who have been in touch with people who are experts in the autism spectrum and just haven't gotten anything about ADHD, try to talk with the people who are working in the various support groups for autism. And sometimes special education teachers can be very helpful for getting some clues. But keep in mind that many doctors, including some pediatricians and psychiatrists, don't have much information about ADHD. And unless they're specialists in autism spectrum, don't have a lot of information about autism spectrum, particularly not in those who are higher functioning. And so it's really important to get some help with either go online and check the support groups that are listed for each of those disorders, and then ask around. And it takes a while to find them, but there are people who know a lot about these things.
One of our attendees asks, given that people with ADHD have impairments in self-monitoring, how reliable is the information obtained during a clinical or diagnostic interview?
That depends an awful lot on who the clinician is. If the clinician, the pediatrician, the psychiatrist, the psychologist, or whatever other professional is working with them, is asking the right questions and listening carefully to what the people are saying, often you can get a lot of information about it. But if you get somebody who's kind of clueless about the specifics of the disorder, both of them, if both of them are involved, you're going to have to look a little further to get somebody to help. And it's often not easy.
What affordable options do adults with very late diagnosis, ADHD, high IQ, to enact an internal executive function conductor when they've missed out on learning life coping skills and are becoming critically frustrated with themselves?
And also having other people getting critically frustrated with them. I think it's not easy to find a clinician who's good at both things, but they are out there. There's some of them, and I go to the support groups for autism, or the support groups for ADHD, or I'd read one or another of these books, or look at that movie, the video on YouTube that I just referred to, and once you get in contact with some of the support groups, sometimes you'll find some people there who are really very helpful. But I don't want to make it sound like it's a snap judgment thing, because it's not that easy.
As a follow-up to that earlier question, when parents are confused about what to do, educating the family with the child in therapy or separately better? I think that's the question.
I think that it depends partly on the age and the strengths and weaknesses of the kid. But when I'm doing evaluations of kids, I always want to see the kids. I don't want to just hear from the parents, and I'd like to get information from teachers and other people as well. But and there's sometimes when you can talk with the child and the parents together in ways that'll be helpful and get them to talk with each other. But there are a lot of times when parents need some help in talking about these things, and you can't, and you need to have the kid taken care of by somebody else while you're having those conversations. It's often a mix.
The next question is regarding neuropsych testing's value in diagnosing ADHD with ADHD being a deficit of executive function. Could there be a kernel of diagnostic value in there for higher IQ folks around testing working memory relative to general cognitive function?
Well, yeah, but you don't need an expensive neuropsychological test to give a simple test of working memory. I've got one that I do for working memory when I do just routine evaluations that takes about 10 minutes. You do not need that full battery of neuropsych tests. Now, I know a lot of people would disagree with me, but I'll tell you, I think the evidence is pretty clear.
Can a change of environment, for example, homeschooling instead of going to school, help a lot with the ADHD or the symptoms?
Sometimes, but there are a lot of potential risks in homeschooling kids who have these special needs, and that is that the parent who's taking care of the kid at home can learn to accommodate to the kid's wishes and problems and strengths. And some parents are amazingly good at it. But if they you're better off usually if you can get related. There are a number of organizations and available at least in the larger cities and bigger towns where you can find opportunities for kids who are being homeschooled to be able to get together in groups of other kids who are being homeschooled in the same age group. And sometimes it's to learn certain academic subjects, sometimes it's for socializing, sometimes it's for sports and recreation stuff. But the reason that's important is that if you keep a kid at home and is not getting much interaction with other kids who has problems like what I've just been describing, they're often not learning the social skills that they desperately need to learn in order to be able to function when they're out and around dealing with other people, particularly other people their age.
How do you handle a teen who is a high achiever with autism spectrum disorder and ADHD and anxiety, who recently started, it looks like, self-mutilation in his senior year of high school?
I would probably want to recognize that kid as scared to death about what he's going to do when he finishes high school, which he's familiar with. And self-mutilation is often used to simply mean a kid who's cutting. And there's some kids who cut and they make, what amount to be not more than others doing scratches. And there are others who will dig in and you have to suture them and you have to do it. But for that sort of thing, it's really a good idea to hunt somebody who really knows quite a bit and who other parents who have raised kids of comparable age, or clinicians who have some experience with it. And I'm sorry I have to keep saying this, but the truth is there are not a whole lot of clinicians who are trained to deal with ADHD even. For almost 20 years, I taught the courses for the American Psychiatric Association for ADHD. And at those conventions, they have the regular program, and then you can sign up for a crash course in any particular specialty. And so, I taught the ones for basic and advanced ADHD, in which I talked also with comorbidities about what we're talking about today. And I often, when I met with a group of 200, 250 psychiatrists, I would say, how much time did you folks have in medical school or in your residency to learn about ADHD and the problems that go with it? The answers average between 0 and 20 minutes. Now, I'm not trying to say that that's true for all psychiatrists or all psychiatrists or all psychologists or all physicians, but you can't take it for granted that they all have it. There are some who've done a really good job of getting enough training to really be able to deal with it, but there's some of them who just don't know that much about it, and you may have to ask around a little bit to find somebody who does.
Is there a good way to improve short-term memory?
Yeah, there are exercises you can do that people can practice remembering things for short term. But the most effective way of improving this is to use the medicines we use for treating ADHD, because often people with ADD, that's a key element of ADHD. And often, if you can get the right medicine to work for the person, which involves sort of tailoring dose, so it's not too much and not too little. Often people who have ADHD who get the medicine that works for them will tell you that their memory, their ability to recognize and organize and pull things out of their head for tasks that they wouldn't otherwise think of improves quite a bit. So getting help with exercises, yeah, sort of, but the medication is the most effective medicine for treating ADHD, and whether it's with or without autism spectrum disorder. But the important thing about the medicine is you've got to be dealing with a prescriber who knows how to fine tune it for this particular person.
Did you have anything else to share before we close out for this evening, Dr. Brown?
No, I just would encourage people to check with Chad about this and check with the autism support groups, and then check that video that I told you about, the 28-minute thing that's on YouTube, and possibly take a look at a couple of the books if there's anything that I've mentioned here that you'd like to know more about.